Awesome. Welcome to an empowering episode of MissPoppins, The Art of Parenting. I'm your host, Nicky Rishi, founder of MissPoppins, a revolutionary parent tech app, and 180 Elevate, a social networking platform for conscious leaders. Today, we're joined by special guest Dawnita, who's the CEO of Woman to Woman Nursing Corporation and Director of Lactation at Emulait. Dawnita is passionate about empowering families to confidentially feed and care for their babies and supporting them through all the overwhelming information that surrounds them. She's an IBCLC International Board Certified Lactation Consultant, a registered nurse, and a public health nurse, a master's trained nursing educator. As a maternal health nurse, she has extensive experience with the birthing process and maternal recovery, along with newborn care and feeding. And I'm your host, Nikki, passionate about creating digital partnering and parenting solutions through MissPoppins. My journey also extends to founding 180 Elevate, but today let's focus on the journey of breastfeeding and lactation. Dawnita, so good to have you today. Welcome to the episode.
Oh, Nikki, thank you so much. I'm excited to be here.
Let's get right into it. Tell us, how do we prepare a new mom, experienced mom for lactation, breastfeeding, pre-birth?
As a mom is expecting her first baby or multiple, maybe second or third, science research shows us that the number one thing that helps them best prepare to meet their feeding goals is to take a breastfeeding class. This, of course, is assuming that breastfeeding is what you're preparing for. The wonderful thing about attending a breastfeeding class is it usually gives you a nice overview of what to expect. And when it comes to preparation for becoming a new mom, and especially for feeding your baby, really expectations is the crux of how to be prepared. If you know just a range of what to expect, then you are going to feel like you have the tools in your belt to be able to tackle each new learning moment. So attending a breastfeeding course is really one of the best things and is linked to some of the higher rates of being able to achieve what your plans were with breastfeeding. It is really important to feel like you connect with your care providers and that you can talk openly with them, whether it's going to be a midwife or an OB. Just get yourself also prepared in knowing what resources you have for after the baby comes. If you're planning on breastfeeding and then also offering some pumped bottles, or maybe you're open to doing bottles and non-breast milk, you just want to know that you're going to have the people to support you after. And so it's a great idea to start looking into your community, maybe talking to your girlfriends, get some referrals from your care providers for people who are going to be able to be on call for after the baby comes. Those are two of the biggest things.
And that's fantastic. Where can we find some of these resources in general, right? There's a lot of online classes that you can do. You could research your local organizations. I think there's something Madres, that's a group, a national group, right? Any couple of key places folks can go to research pre-birth breastfeeding classes or pointers, recommendations.
Oh, there sure is. So, of course, your hospital is going to be a really key place for each mother who's going to deliver. And if you're going to do a birthing center, then they usually also will have classes. These are easy places because it's going to be a natural fit. You're going to be with care providers that can, help you get scheduled and block you right in there. But if you just want to do your own search for the local area, then La Leche League is always an easy place to start. But also the Lactation Network is another great place, because this is a company that has developed a network of insurance-covered lactation consultants, and it's nationwide. So they're able to just pop in there, see who their providers are going to be, and then maybe you can do a little research before the baby comes in finding out which lactation consultant would fit best for you. As far as finding classes, using your hospital is going to be your easiest place, but then also following some lactation consultants in your local community and then on their social medias, and they'll find out who's going to be doing the prenatal visits or classes that can get you prepared beforehand.
And then, of course, one of the first questions that we find very frequently that's asked in mom groups and such is, when will my milk come? Right? So what do we say to that question?
Oh, we're just getting absolute to the meat of it. This is one of my favorite questions. All right. So the few things that I hear moms talk about after they deliver, and even their families talking about it, and even professionals that work in the field, coming from 15 years of working on hospital floors. And I cannot tell you how many times I've heard, oh, her milk's not in yet. So we're going to have to go ahead and figure out something else. So I want to let everybody know right now that once you're in the later trimester of your pregnancy, that whole last third trimester, right, 27 weeks on, your body has already started to prepare what I call that first milk, the golden milk. This is your colostrum, and that is your first milk. So you should rest assured that once you go in and deliver, and when that happens, when the baby comes out, so does the placenta that was nourishing the baby. That triggers a hormonal shift in your body. And so your milk coming in, what that's talking about is on day 3, 4, maybe day 5, if you're a first-time mom. That's when you're going to feel like your milk is coming in. And that's why it's given that term. So you already have your first milk, your golden milk, and it is lower in quantity, but it is super high in its quality. And so when the baby gets on there, they're actually coating like their intestinal tract, almost like pavement between bricks, so that when your milk comes in and the baby continues through a lifelong of eating, their intestinal tract is set for life to be able to resist allergens, anti-inflammatory agents. It's wonderful. So those first 2 days of having that first milk is key. It really does prepare quite a bit. Now, when that milk comes in and you're talking about the day 3 or 4 or 5, I just want the moms that are listening to know you're going to feel like Dolly Parton. You are really going to absolutely feel like there is a traffic jam going on right here. And so many of us can get worried because it's not comfortable. It actually, you feel like, oh my gosh, is this what I read about mastitis and blocked ducts and all these things? And I just want you to know it's actually called natural engorgement. So when you start to feel that heaviness right under your armpits, remember this moment. And what I want you to do is go, oh my gosh, this means my body is doing it. It's making the higher volumes of milk now because now the baby's ready for these full feeds. And it's going to come in almost like in an oversupply and give it about 2 days and things settle. Ice packs, cold packs, maybe a frozen pack of peas are going to be your best friend.
And does this differ with natural labor delivery versus C-section, the colostrum? I had twin boys with a C-section and I know I struggled and it was very little. But with all of the medication and everything that goes in to a C-section versus labor, should there be an expectation of your answer to be different in both scenarios, or is it pretty much the same and the same tips and pointers to follow?
I'm so glad you asked. You know, it's really important to be informed, but don't necessarily be afraid. You can be informed that as labor, and then of course the delivery and birth of your baby or babies in your situation, as that comes, the more complicated it is, then it's good to be informed that your body may need a little bit more support and time to end up, adapting and transitioning and being able to supply that full supply of milk and into this, this feeding source for the baby. So if you are, things that you would look for would be really extended labor. So we're talking about like labor's lasting longer than 24 hours and then it goes to a C-section. Those tend to be the situations where the body's like, man, I am just beat. If you lose a lot of blood, enough to where you kind of need a blood transfusion, that's one where you're probably going to need some extra support. And so you'd want to invest right away with making sure that they're replacing fluids, you're pumping, you're stimulating. So whenever the laboring is difficult, long, or extended, that's when the body might need, like I said, extra support and time and being able to adapt to its role of feeding these babies. So the more patient mom can be with herself and just know her body's not failing her and she's not failing the baby. What she needs right now is energy, hydration, and then just some time to learn. And so the pump is really a great support during that time, because especially if you're having multiple babies, Nikki, I come from a twin family myself. My hero of a mother, she had 2 sets of twins after me. And I tell you, I remember being up all night doing these factory lines, of getting everything ready for the babies the next day. And I've worked with twin moms and even triplet moms so many times, countless over the years. And it looks a little different for each family when you have multiples. Are you an older mom and was this IVF? Were you, is this not your first baby? have you already lactated and breastfed before, then your body tends to be able to adapt into that role of making not just enough milk for one blessed little human being, but two. So the more your body it just really depends. It's unique is what I'm saying. So it's good to be informed, but don't be afraid, because really, it's really like present. It's going to be what it's going to be. You're just unwrapping it to find out. So just surround yourself with people who are supportive and knowledgeable, and give yourself grace.
Okay, thank you for sharing that, Dawnita. Where would the key to successful latching come for your newborn? Of course, that is something that moms struggle with quite a bit. They give up breastfeeding. I almost wanted to. They go exclusive pumping. There's just so many different challenges and struggle, right? What is the key to successful latching for newborn?
You know, what I'll do is give you just a few basics that really can make all the difference. One, understanding that you are connecting to people. It's that thing. So you now have your body that you're going to be looking at and feeling in a different way. And then you're taking your baby and you're connecting that baby with your body. When you view it in that way, you're able to go, okay, this is going to look a little different than just the nipple entering the mouth. Because if you go into the latching experience and you think, I'm going to put that nipple in the mouth, then what's going to happen is your baby's going to come from kind of an awkward angle. And with that, they may have a hard time getting in and getting latched, and your nipple may get sore because they're going to be sucking on it from this superficial place. And a lot of times that's what we hear people say, like, oh, I got so, I'm so sore. And so that I cast the superficial latch. So here's your pointers. There's 3 of them to be able to get a deep latch. One of them is, don't think that you need to continuously to put baby on, take them off if it's not a perfect latch, and then put them back on. Like that just makes your nipple sore. If you get connection with the baby on you, then keep it. It's actually how you support the baby and your breast to get them to go deeper. So one thing I'll let you know is that as mom is bringing baby to the breast, you want to bring them from underneath the areola. We're not doing nipple in mouth. So if you let that areola rest above the mouth, wherever that may be, it really gives you the perspective of like, oh, my baby's going to come up, right? And you just connect the two, you get suction, and then here's the key. Don't push down on the baby's head. When you push down on baby's head, it drops your chin, and it's going to create a shallow latch. What you want to do is support baby at the shoulders and let their head tilt back. That opens up their mouth, and that's how you get the drop in the jaw. The other thing is that you want to lift and support your breast from the bottom. I always put right there because I want it to really sink in. For all those moms who don't want to have like super sore nipples and they want to work on that latch, your instinct will be to push down to get it into the mouth. I want to let you know, your thumb, when you get into that situation, it's fine to get it initially in, but then you want to get it out of dodge. You want to kick it back like the kickstand on your bike when you were a kid. Get it out of the way, because otherwise you're going to hold that tissue down and baby isn't going to be able to latch, and you're your own enemy. We don't want to push it down into the mouth. You want to lift it from the bottom and let baby have a nice deep latch. So it's the support from the bottom that makes a huge difference on the latch.
Fantastic. Thank you so much for showing that live. I wish I had that.
If I had $5 for every time, right?
Someone tells you that?
Oh, absolutely. Even grandmothers, and this goes generational. If only, if I had known, the last thing is you do want to, it's a thing to do for a living, I'll tell you. The last thing is you want to choose any bottle that you're going to use wisely. If you are looking to protect the latch and the feeding experience, so the baby isn't necessarily confused. I know a lot of times we hear things like nipple confusion, and really what it boils down to oftentimes are 2 things. One, bottle is being used that is very hard it's a silicone extended long nipple. And the baby gets used to feeling that in the roof of their mouth. And Nikki, the interesting thing is a lot of people don't understand, but babies latch in the first month or 2 of life because of reflexes. They have a button on the roof of their mouth, and it's the suck reflex. So when your breast goes into their mouth, that's why it's really important that the baby's coming from underneath, is so that nipple can come and hit the roof of their mouth. And when they feel that, they start sucking. Another reason why it's really important not to push down. Otherwise, that nipple will never make it up to the roof of the mouth. But if you're giving a bottle that's really hard and it goes in and it taps the roof of the mouth really in a firm way, the baby goes, oh, that's my cue to eat. So then from that point forward, if they come for a feed and the breast is being presented and it doesn't immediately hit the roof of the mouth, the baby gets frustrated. And obviously, usually the bottles are going to flow faster too. So that's one of the reasons why I was excited to become a part of Emulait, is because it's the first bottle that uses biomimetic technology to replicate the feel of the human breast. So it's softer, and you can see like no other. The nipple actually will even roll like the human nipple. But more importantly, when the baby latches, it actually stretches and goes in. So that's so important to replicate. And so this is another way that you can protect your latch, is that if you do by choice or need, medical supplementation, need to use a bottle, you want to pick one wisely from the start.
Fantastic. I cannot wait to talk about this more after this webinar and really make this a big awareness campaign, especially since I know I would have loved to know about this. Let's talk about customizing, right? You're talking about bottle breastfeeding. We hear about the idea that not everyone's the same, not everyone's nipple sizes are the same, not everyone's baby and percentiles are the same. It's just everything is unique in this journey. How do you tailor lactation support? Yes. So how would you tailor lactation support for moms to address their needs, whether she decides to bottle feed or breastfeed at the same time?
The feeding journey that we plan on doing and the feeding journey that we end up experiencing can be the same, and they can be very different, as you know. Once you enter into the baby being present on stage and you're experiencing the stressors of feeding, that's when we end up making the decisions that are going to be a part of our feeding experience. So knowing ahead of time, whatever your priority is the way to stay prepared. So if you know that breastfeeding, naturally feeding the baby is going to be the top priority, and that is what your intention is, then you just want to think about, okay, what does that look like for me down the line? Am I returning to work? Will I occasionally want to be able to step away and have the baby be fed by another caretaker? And if so, then again, you want to choose a bottle that's going to support the breastfeeding experience. If you're going to be if you're open to exclusively pumping and you think, for my personality and my family and my lifestyle, I think I'm probably going to end up doing mostly pumping because it's more controlled. There's a routine to it. I'm going to be able to see what the baby's taking. And for us and our family, that's really important. Then it's going to be really important for you to prepare yourself ahead with understanding natural feeding volumes and sizes and how many times the baby feeds. Just as much as it's important when you choose a bottle for it to be in a biomimetic fashion, you want to do the actions of feeding also in a way that looks to nature and replicates it. So if you're going to do a dual feeding routine, then you want to get informed. You want to have somebody come and help you who knows both, but you also want to understand yourself. How much does a baby usually drink in the first month of life at each feed? How frequently do they usually eat? And that way, when you're doing the bottles, you're giving the baby a very natural feeding experience. And so they're not going to be unnecessarily uncomfortable with gas. And gas for infants is almost always linked to just overfeeding.
Very common.
Yeah. And what it does is it brings in a lot of confusion. So if you're able to mimic that in your dual feeding routine, then you will be very happy about it.
Okay. I do want to talk about Emulait a little bit because you mentioned the bottle and I can't get it out of my head. And I really want to, but you know what? Let's finish the topic around nutrition, sleep, and some of the positions. And we'll talk about this wonderful innovation that all moms should know about. For example, at MissPoppins, we provide holistic approach to motherhood, lactation, and we know that sleep, nutrition, and overall mom wellness has direct impact on the whole journey and the experience, especially direct impact on potentially milk supply. Is this true? What are some of the tips and pointers for mom to increase their milk supply? There's just plethora of information out there. Perhaps because we are going to be running out of time and you have so much to share, and I wish we could have this be a forever webinar. What are the high-level pointers about links and things that they should be doing to increase the
Excellent.
supply.
If you are looking at managing your baby's sleep, and I know this comes in the form of sleep training, or you're just looking at giving maybe dream feed. Some of these terms are already familiar to the moms that are out there. The things that I would want you to know so that you're making informed decisions is that from midnight to 5 a.m., from midnight till dawn, you have a hormone that spikes and peaks, and that hormone needs to be triggered by a breastfeeding session or a pumping session in order for your body to maintain enough milk for your baby on a full daily basis. If you end up using some sort of a sleep training technique that helps baby sleep through that window earlier than they normally or naturally would, then you want to go ahead and implement a plan to protect your milk. And that's going to be a simple pump during the midnight to 5 a.m. session. With that, then you won't be taken by surprise. So what usually does happen, Nikki, is that I'll have a mom reach out to me. She's like, I have low milk supply. The baby's not gaining great weight. And so I start to screen them, and we'll find out that the baby's, been using automated bassinet or sleep training techniques and has been sleeping from 7 at night to 7 in the morning. And then she had no idea that there was this spike in her hormones from midnight to 5 a.m. and that babies naturally would eat once or twice during that time. So all you have to do is bring back stimulation to that window. It can have a huge impact, and you want to catch it as soon as possible. So just by being informed and having that expectation that it is actually normal for that stimulation to happen, then you probably will just be able to avoid that hiccup altogether. Babies usually maintain their 5 a.m. feed all the way through until they're about 9 months old, or they're really starting to dig into their solids. Once they dig into their solids, then they will actually through that 5 a.m. window. But that's the best way for a mom to protect her supply.
I think there is this missing link as you talk about it, where sleep coaches, and I used a sleep coach, should highlight that, right? It should be part and parcel of how you get holistic coaching and holistic training, whether it's lactation. 12 to 5 a.m., that's fantastic to know. And what are the reasons that's not happening? So it should naturally be embedded into sleep training. And unfortunately, sometimes it's not. So thank you for calling out attention to that. Yeah. Let's shift a little bit into hygiene. That's so important, right? Whether it's messed up, anything that we can do to help moms out there understand the concept. They use things like warm water and soap before feeding to help prevent that. So maybe focusing on the signs of mastitis,
yes,
and what should we be vigilant about?
With mastitis, clogged ducts, and nipple blebs, these are all things that are of high concern for moms. So I would love to just start out with going, it isn't necessarily related to cleanliness. So the action of washing your breast actually washes away some of the protection of what you have. Nipples are not sterile. And so they come in, they're clean, but they're not sterile. And you have Montgomery glands all around your nipples. Those are those awesome little bumps that give our breast character. And what they do is they exude a little bit of oil, and that oil actually has anti-infective agents about it. And so you don't want to wash that off. So you're fine just feeding your baby. You want to keep your pump equipment clean if you're pumping. And so a way to do that is you just simply wash it. Again, nipples aren't sterile. You don't have to sterilize everything to prevent mastitis. In fact, research shows us that sterilizing everything every single time actually makes you a little more high risk for it, because we're removing good, normal bacteria that lives on our body. The number one cause to mastitis is going to be, hear me out, mamas, overproduction. This is going to be mom is breastfeeding, and then she's also pumping, super excited to grab that extra milk and throw it in the freezer so she can build the igloo, take a picture, and post it. It feels like more milk, more better, right? The more that I am making, the better job I am doing as mom. And so the fact is that putting our body in that overstressed state is what causes the inflammation and the backing up. And then those ducts cannot release because they're so swollen. So that's going, and then you're going to get the redness, the pain. And if that increases, and then ultimately you'll get a fever. That's when you're going to definitely move forward with your care provider, and you're going to probably need some antibiotics to support you in that. But the Academy of Breastfeeding Medicine recommends that if you realize, I'm starting to get what I see on the internet is always a clogged duct. It's a full duct that can't let the milk out because everything's so compact and pressed in. You want to start applying cold packs, and you want to start looking at what you're doing. Am I overproducing because I'm just doing too much? I am multitasking this whole thing. So you want to get some support from a professional to regulate your milk, and that'll prevent any mastitis.
And we're definitely going to go over our time, folks, but this is such a good conversation. Let's give it 10 more minutes.
I have the time if you do.
We definitely do. I loved small little tips and pointers, such as having an electric toothbrush help with little clogs or any forms of such pores that would happen. And so many things like that are out there to help prevent, right? But yes, understanding to not overly clean, since that's what we sometimes tend to do. That's a really great point.
And it does go hand in hand too with like overly pressure and pushing deeply. It can cause inflammation. So some of the newer recommendations, since you brought up a really great point with like the vibrating toothbrush, there's breast massagers, there's a lot of things on the market, but just because they're on the market doesn't necessarily mean that they're only going to be good for you with your breastfeeding. And so actually doing kind of like a low stimulating pressure can be okay while you're pumping or trying to get those clogged out. But it isn't so much just something that has to get pushed past. We need the inflammation to come down so it can flow. So that's why cold packing and then just giving the breast a little bit of a gentle rub can be more helpful than applying direct pressure and vibration.
Thank you.
You're welcome.
One of the things that maternity leave, I feel our society, of course, pushes moms to be all, do it all. And there's a lot of pressure that builds up, right? Maternity leave ends, mom goes back to work. And I have noticed that with my friends, breastfeeding, the milk supply becomes less. How can moms prepare for their breastfeeding journey when leave ends and they have to go back to work?
As you get closer to going back to work, moms, I want you to know that it doesn't make you not a breastfeeding mom. What will happen is you will be providing some of your breast milk by pumping sessions while you're at work, and then you can still have the contact breastfeeding at home or pump and bottle at home, and it's still breastfeeding. The best way to protect your milk supply is to stay consistent with pumping about the same times baby's eating while they're back at home. So if they're eating at 9, 12, and 3, then when you're at work, pump at 9, 12, and 3. If that doesn't work with your profession, then you just want to try to match it. Plan B would be match it as many times as they eat. So for that mom, it would be, I just need to pump 3 times. And then you want to always try to nurse before you go to work. So say you're going to leave at 7 in the morning, try to nurse baby at 6. And then you want to do you're going to return at 5 p.m. Try to make your last pumping session maybe 2 or 3 o'clock. So that when you reunite with baby, you're ready to breastfeed them. And then that helps it stay simple. The other big things are whenever we go back to work, we're starting to look to get back into our work clothes. And so I want to let the moms know that you don't really want to do any crash dieting. You don't want to sweat really hard. If you're exercising so hard you can't talk, you are burning calories that would make milk. And this can directly impact your milk. So if you're burning that many calories, you want to be sure that you're replacing them. So make sure that you are still eating 500 to 800 extra calories a day, drinking at least 3 liters of fluid. And those things right there tend to protect the milk supply.
Moms, it's 1 year, and I think you should give yourself grace and have the concept of wellness, body image, positive body image. First and foremost, baby, will always be able to get back to the normal routine. But I think the first 2-3 years, giving ourselves a little grace, and the tips and pointers that Dawnita mentioned are so key to not give us that pressure and to continue that beautiful breastfeeding journey. I would love to talk about Emulait a little bit. I cannot tell you enough how much I researched bottles and, whether it's different brands out there that have made their name and awareness. It didn't suit the twins. Something was missing. So I'd love to hear how you are different, how Emulait is different. What's the innovative technology? Tell us, how does it mimic the mother's breast? What else is there to know about? Love to hear new tech that's out there to help.
Absolutely. One of the questions you had asked earlier about how each woman is unique in their feeding experience. As I'm talking to mothers, I often tell them nipples are like flowers. They come in all different shapes, sizes, and colors, and they're all glorious by their own design. Some are a little more challenging to breastfeed with in the first few days, but really it's everybody is different, but that's all very normal. So to approach a bottle where there actually can be some tailoring, where the bottle looks and feels like that mom as much as possible. Makes all the difference. So as a lactation consultant, when I came to awareness of the design of this bottle, I just really had to be a part of it. The bottle shape, as far as the nipple, it comes in 5 different shapes. These shapes were based on a study that's been published in a medical journal of 1,000 different perinatal women. And so what that means is they were pregnant or just had a baby, and they scanned their nipple using our depth dimensional analysis in our app. And they figured out long, short, wide nipples, and we chose the 5 most common. And so what a mom can do is use that app and scan her breast, and it's going to give you shape 1, 2, 3, or 5, 4 or 5. And then there's 5 colors. As you know, your areolas darken when you become pregnant. And that happens usually in the 2nd trimester. And this is so baby can kind of nuzzle in and find you when they want to breastfeed. And so that happens for a reason. Everything from this bottle, all the way from color to texture to feel to function, has been mimicked after the breast. And so a mom is able to choose her skin tone out of the 5 shapes that are available also. So not only is this amazing for the baby because it's familiar, but also it's amazing for mom because whether she's feeding with the bottle or she's away, she can know that her baby's having an experience that's very familiar to her. There's a bit of mom that's still there in the feeding process. The design of the bottle with the nipple, I love to show, it's a 2-chamber system. And so we have a flow valve where you can personalize the flow to slow, medium, or fast. Right on top, you're going to notice the bumps. These bumps are there just for sensory of the baby. So it feels like that areola bumps. And inside the nipple, you're going to see these beautiful little tubes. Milk does not flow through there, so you do not need to worry about getting those clean. They're really just there for the sensation, the sensory experience of the baby, because this is why so many babies will either refuse a bottle or have difficulty with it. And so as they come to this bottle, the shape of the actual nipple and areola portion changes once the baby latches. It's the only bottle where a baby actually gets on and it's not pre-shaped. The only thing that's pre-shaped is the nipple to match mom. But once the baby latches, it's going to extend into their mouth. And you see here how the portions on the top and the bottom can extend. So it's going to open up and it's going to have that bulbular shape that the breast has in a baby's mouth. And the nipple's going to extend by at least double the size deep into their mouth so that it can suckle with their tongue and jaw muscles, which is very unique to Emulait. The reason this matters is because research has shown us that individuals that were breastfed later have better relationships with food, lower rates of obesity, and better emotional regulation. Some of those reasons are because when they breastfeed, they use these jaw muscles, and the vagus nerve is what's responsible for them. Well, that vagus nerve is what's responsible for our fight and flight when we're adults. And so all that stimulation with eating is what gives us some of those skills as adults. Because the Emulait bottle is designed to use those natural muscles, now a baby who is either primarily or all the way bottle fed has access to using those same muscles. Also, babies tend to overeat less because they're going to be engaged in the feeding process more than just like sucking on a straw. And this really is what it's like on most commercial bottles. The tongue is wrapped around this hard silicone nipple and it piston sucks, but it doesn't milk and stay involved in it. And so with that, they would eat faster. And then it's like us going to a buffet, you eat more. So if that's their feeding experience at every single feed, then it makes sense why babies who are bottle fed primarily have higher rates of obesity, is because they're used to feeling that stretched out full feeling every single time. But with a bottle that functions more like the breast, parents are able to have more responsive feeding experiences. So the baby's able to cradle in the arm, receive the bottle in a relaxed, natural leaned back position. Eye contact has been restored to the feeding experience when it's a bottle feed. And now parents can look down and watch the baby become relaxed, full, give those cues, and they can use responsive techniques to be able to stop the feed because they can tell their baby's full, rather than just keep feeding until the baby's milk drunk.
Thank you. Thank you for thinking about this so deeply and going through the whole process to build something that so many moms in the modern generation are going to need, and have a simplistic way to make it mirror the natural biology. It's a good segue into our Q&A. since we were talking about bottle feeding, one of the questions that has come up as we're heading towards the end of our webinar is, how will I know if I fed my baby enough with a bottle? So you're talking about Emulait's technology, figuring that part out, but for other mothers who are curious,
yes,
with bottle feeding.
The biggest thing is what I had mentioned earlier with becoming familiar with natural feeding volumes and how frequently a baby eats. So these resources are still going to be directed by your healthcare team. And so we have expert lactation team at Emulait, but we're always very direct in saying this doesn't replace any of your healthcare guidance from your team. This is more information. So what you want to do is become familiar with how much does my baby eat at this age and weight. So for example, if your baby is in the first month of life, and they're average for their size, meaning they're anywhere from 6 to 8 pounds, they're probably going to drink anywhere from 2 to 3 ounces at each feed. That's so important to know, because if you know that on the upper end it's 3 ounces, you'll really slow your bottle feeds down when you start to get to the latter portion of that second ounce, rather than if you have no frame of reference, no expectations for what your baby's going to eat. Your doctor's just telling you, oh, just feed them until they're full. You have no clue, and the bottle holds anywhere from 8 to 12 ounces. So you're like, great, they'll take 5 ounces and then they go to sleep. That's when you end up in a situation where baby's over full. So if you know in the first month of life, it's about 2 to 3 ounces, then you're able to watch for those feelings, watch for those signs from your baby. Their sucking is slowing down. That's a method you can find. You're going to notice the baby's sucking slowing down. Their arm's going to start to relax a little and their hand will open. So what you can do if it's a bottle feed is you can even take it out for a moment, rest the baby on your chest, tuck a blanket under your arms, get them in that natural hold. This would be like where they only have a little ½ ounce left. This is kind of a trick for those babies that are mostly bottle fed, or if they have a chunk of time where they're bottle fed. Save that ½ ounce like dessert. Go ahead and take them out, tuck them in on your chest, let them have that snuggle time, then drop them back in, let them finish that last ½ ounce. They're set. And what you've given them is the time to start digesting the milk. When babies bottle feed, it's traditionally, with most commercial bottles, it's so fast, their gut doesn't have time to talk to their brain. And so there's not enough time to digest and that sugar to raise and the baby to go, yeah, you know what, I'm full, I'm going to stop eating. And so when you use these techniques, you know the range of feeding size and you kind of save that last ½ ounce and then you give that last ½ ounce. Now you've added a few extra minutes and the baby then goes, yeah, I'm going to start acting calm because I'm done eating. And that's the way you're able to bring in that natural, responsive feeding into bottle feeding. I'm glad you asked.
Fantastic. Yes. I'm going to combine 2 questions in the interest of time.
Perfect.
As our last 2 questions. As a breastfeeding mom of twins, I found it to be mentally draining, struggling with guilt. The fact that they had to feed through bottle, chair. So how can moms of multiples or just moms that can't breastfeed, how can they find the balance and find the mental relief, right? Question 1. And then the last question would be just 101 on storing breast milk. Such an important question as well.
Absolutely. Breast milk's the easy one, so I'll start with that. And then feeling guilty about breastfeeding is my ultimate favorite. So I'm going to close with that one. So when you're storing your breast milk, CDC has updated recommendations. We can keep it nice and easy. Think about the rules of 4. Your breast milk is going to be able to come out, be pumped, left on the counter for 3 to 4 hours. That means if you're pumping for your next feed, there's no need to pop it in the fridge and then warm it back up. The less processing, the better. But if you are going to store it, then you can have it in the refrigerator for 3 to 4 days. And then ultimately, if you're going to be freezing it, freeze in bags of 2 or 3 ounces. So you can always make different size bottles. And then you can leave it in the freezer for 4 to 6 months. And then of course, a deep freezer for up to a year. There's also some pretty amazing companies out there. I think Latch is one of them where you can freeze dry your breast milk. This extends the life of it for far beyond the 1 year. And so those are going to be some storage options that you have for you. As far as having complications with the needs of the baby exceeding what mom's able to meet with her breast, this happens to us as women for many different reasons. Twins are absolutely one of them. And so, but the others are circumstances of life, maybe just an anatomy issue where you're missing a portion of your breast and you didn't really know that until you went to go breastfeeding. Perhaps it was surgery, something that you had. whatever the reason is. When you're having a hard time with breastfeeding and bottle feeding becomes a part of it, and then perhaps even formula feeding becomes a part of it, what you really want to do is, I learned this from my mother, 2 sets of twins, as I mentioned earlier. You give the best you have at the time. And it's good. The only way to really work through the guilt of going, gosh, I didn't do exclusive breastfeeding like I had planned. And yeah, we know that natural act of breastfeeding and exposure to breast milk is going to be the healthiest for the baby. So it doesn't make mom or me feel any less guilty about not doing it by going, it doesn't matter. Well, we know it matters, right? Because science already tells us it's the healthiest. So what do we do with that? How do we reconcile the two? One, you just embrace the fact that you're human. We can't do everything every single time. And I bottle fed and formula fed my 3rd baby. And I had to process through this in a very real and raw way. The only way I got to the other side of it was to go, I gave her the best I had at the time. And so when you're able to bring back relational aspects to the bottle feeding experience, that's when you're able to really embrace and just go, you know what I was able to give? I was able to give eye contact. I was able to give a comfortable, knowledgeable feed where, the baby was enjoying the feed and was still comfortable hours later. And then after that, just enjoy what you're able to bring to the baby outside of the realm of feeding. And so the baby just wants our best, and that's all that we can give. And so guilt has a role to play. It keeps us upping our game as mothers, but I'll tell you what, it can also be a beast. And so it's good to keep it in check. We'll never get rid of it. It's impossible, but it is good for us to acknowledge it, acknowledge why, and just say, I'm giving the best I have at this time. And you know what? I know I love my baby and they know they're loved.
Fantastic words to live by. Thank you for an enlightening discussion today, Dawnita, that has shed light on the complexities. Perfect. Underscoring the critical role, folks, of tailored support and innovative strategies in empowering parents through these unique challenges. Dawnita, your dedication to providing comprehensive support and enhancing the well-being towards nurturing healthier families and communities, we thank you for that. As we wrap up this episode, we would like to give our attendees today a special discount on MissPoppins, 20% off your first session, and from Emulait. I want to have a baby now, so I can just use the bottle and
enjoy the bottle.
Thank you for a 10% discount that's going to be valid for 48 hours. We hope you enjoy and give your feedback. And to our listeners, we hope this episode of MissPoppins, The Art of Parenting, empowered you with knowledge and inspiration as you navigate your parenting journey. Stay tuned for more episodes. And until next time, embrace the art of parenting with confidence and love. Thank you all.